Welcome to Your Health. I'm your host, Rhonda Alfred, and joining me on this episode is Dr. Peter Pham, Interventional Cardiologist at Cardiovascular Institute of the South and Terrebonne General Health System. He's here to share with us some information on heart disease. Welcome to the show, Dr. Pham.
Thank you, Rhonda.
All right. Well, it's been a while since we've had time to talk about this, right?
Yeah, it has.
All right. Well, let's get right into it. First, let's talk about you a little bit more about yourself and your role at Terrebonne General.
So I'm an interventional cardiologist. I've been here for 25 years. I'm the head of the cardiac cath lab and the structural heart program here at Terrebonne.
Okay. So let's just talk some basics. What is heart disease?
You know, heart disease covers a big sort of gamut. I think when most of us think about heart disease, we think of obstructive disease. We think of a blockage, if you will, in the coronary arteries. And that by far is the lion's share of heart disease. There's obviously electrical system, there's valvular system, but the vast majority of people, when they talk about heart disease, what they're thinking about is coronary artery disease or a blockage in the coronary arteries.
Okay. And is that like a heart attack?
Well, so it can cover the entire spectrum. So those people who can have coronary artery disease and be silent and have absolutely no symptoms. There are those people who will have angina, will have chest pain, but they don't have any heart damage. And then there's finally, at the end stage, would be somebody who would have a heart attack, where you actually would cause some myocardial or some heart damage itself.
Okay. And who is at risk?
So we typically think of those people, the five big parameters would be those people who have very high cholesterol, those people who smoke, those people who have diabetes, those people who have high cholesterol, and those people who had parents or family members who had an acute event at a young age.
Okay. And what are the symptoms of heart disease?
So heart disease in of itself doesn't have a symptom. Okay, but what is the ramifications of heart disease. So those people who would think about having heart disease, what I would typically say would angina. So they would come and say, I've been having chest discomfort. Typically they would describe it as a squeezing sensation, typically with activity and a leave with rest. Sometimes you'll be exacerbated with emotional stress. So having a fight with your spouse or your kids may bring on some chest discomfort. May also have some radiation to your jaw or to your shoulder. You could have some shortness of breath or having a difficult time taking a deep breath. And then obviously if this lasts on or persists for an extended period of time, then potentially that what you're having is myocardial damage or a heart attack.
And what should you do if that happens?
Well, first of all, if this is a new onset, if this is something that you have some chest discomfort that isn't going away, you need to go to the emergency. You need to call 911 to go to the emergency room. If you have some discomfort that is easily relieved, then you need to seek medical care relatively easily or relatively soon. One of the problems we seem to see in those patients who come to the emergency room is that they will tell us that, yeah, you know, I've been having chest pain for a couple of weeks and I sort of ignored it because I thought it would get better. It's not going to get better. It's only going to get worse. So the sooner you seek out treatment, the better chance you have of preventing some damage.
What are the treatment options?
So it runs the gamut. So the first one obviously is medical therapy, aggressive medical therapy, which would include cholesterol medicine if your cholesterol is elevated, diabetic medicine if you're a diabetic, blood pressure medicine, obviously, and then goes into more aggressive therapy. So that would be coronary artery stenting, angioplasty, and then finally, if need be, coronary artery bypass grafting or surgery, open heart surgery.
Well, there's a lot that you can do.
Yes, absolutely.
The technology's unbelievable, but...
Yeah, no, a lot.
Okay, well, how common is heart disease?
Very common. It's literally, you know, I always have a comment that you can't swing a dead cat in Houma, Louisiana and not hit somebody with heart disease. It's very true. Heart disease is very common and it's very prevalent. The problem we have with it is that it doesn't give you an advertisement. It doesn't warn you up front. And so that's why we always tell you, you know, go see your family physician, go see your cardiologist, make sure you're getting at least evaluated, make sure your cholesterol's okay, things like that.
Okay, and how can you prevent heart disease, or can you prevent heart disease?
Well, you know, obviously you can't change mom and dad. Okay, if you're a diabetic, you really can't change that, but you can basically take care of your blood sugars. But more importantly, the things, if you smoke, stop. You know, that's one of the bigger ones. Making sure your blood pressure is controlled and making sure your cholesterol is aggressively controlled. Those three things really, if you can get in front of those, that will basically slow the progression. You know, if you wind up having a heart attack at 90, not a good thing, but much better than having a heart attack at 60.
Right, right. Okay, and again, what should someone do if they're experiencing heart disease?
So if you're experiencing chest discomfort, okay, then you need to seek out therapy. You need to seek out treatment right away. It's very difficult to say you should do this or you should do that. I always would say go to the emergency room if you're having chest pain that's just unrelenting. I can't get rid of it. It's been there for 15 or 20 minutes and it just keeps, call 911, go to the emergency room, let them figure out what's going on. After that, if it turns out to be heart or suspected heart, then you'd wind up doing some studies. If you come in and the ER physician or your primary care physician says you did not have a heart attack, then the next thing would be, well, let's do a stress test. And there are several different types of stress tests. You can do a nuclear stress test or a running treadmill stress test. Let's do an ultrasound to see if there's other reasons for chest discomfort, and then some lab work to see what your cholesterol is. And that would be the standard workup to see where we go next. Those are basically how we would approach that. So I would say if you're having some, seek treatment immediately.
Okay. So pay attention to your body, right?
Absolutely.
All right. Well, Dr. Pham, thank you so much for sharing these helpful tips with us today. We appreciate it.
Thank you, Rhonda.
For more information about heart disease, visit tghealthsystem.com. Thanks for joining us on To Your Health. I'm your host, Rhonda Alfred, and I'll see you right back here next week.